cardiac cycle. The cardiac cycle is the sequence of events that occurs in the heart during one complete heartbeat. This cycle lasts about 0.8 seconds. It includes systole, contraction, and diastole, relaxation of the atria and the ventricles. The cardiac cycle has three main phases. The first phase is atrial systole. It lasts about 0.1 seconds. Here, both atria contract. The atrioventricular valves, tricuspid and bicuspid, open, while the semilunar valves remain closed. Blood flows from both atria into the ventricles. The second phase is ventricular systole. It has two parts. First, isovolumetric contraction, lasting about 0.05 seconds. The ventricles contract. Pressure rises. The atrioventricular valves close, producing the first heart sound, LUB. Second, ventricular ejection, lasting about 0.25 seconds. The semilunar valves open. Blood is ejected from the right ventricle to the lungs, through the pulmonary artery, and from the left ventricle to the body, through the aorta. Now comes the third phase, ventricular diastole. It also has two parts. First, isovolumetric relaxation, about 0.1 seconds. The ventricles relax, pressure falls, all valves stay closed. Backflow shuts the semilunar valves. This produces the second heart sound, DUB. Second, ventricular filling, lasting about 0.4 seconds. The atrioventricular valves open. Blood flows freely into the ventricles. The semilunar valves stay closed. This prepares the ventricles for the next heartbeat. Thank you for watching my video. If you have any confusion about the anatomy of the heart or blood circulation, check out my other video by clicking on the top right corner of this screen.